Last 2 units of the semester here. Okay, we're going to start with the units or muscles that move the knee, and then we'll finish with the muscles that move the ankle. We won't worry about the toes. Okay, so just muscles of the knee, and then muscles of the ankle. Now we talked about the movements of the knee, so let's quickly review them here. Again, standing in that anatomical position. Flexion of the knee is going to be coming up. Extension is coming down. Flexion up, extension down. We can also have internal and external rotation of that knee. Okay. And again, that's where the tibia, okay, is twisting on the knee. And remember, that can only happen when your knee is bent. Okay. So if my knee is straight here, I can't have internal and external rotation of the knee. It has to be bent for my tibia to be able to twist back and forth. Flexion extension movements, okay, they happen in that sagittal plane. Rotational movements, those happen in the transverse. Okay, you should have this in your packet there. All these are muscles that move the knee. Now I want to emphasize here, we've got a lot of muscles, okay, about half of them that we talked about last unit. We're not going to worry about the origin insertion for the muscles from the last unit, but you will need to know the actions that happen at the knee that those muscles perform. And we'll go through those here. Let's start with the gastrocnemius. Big old calf muscle. We will need to know origin and insertion for the gastrocnemius. Notice all the way at the top, they originate at the medial and lateral condyles of the femur. So they cross the hip or the knee joints. Insertion via the Achilles tendon, going to go all the way down to the posterior calcaneus. Essentially, it inserts at your heel. And since these muscle fibers are running straight up and down across the knee joint, the gastrocnemius is going to help with knee flexion. Any of you done leg curls? Okay. So look in here, any sort of leg curl movement here. Okay. Oftentimes people think, okay, we're using our hamstrings, and we do. Okay. But sometimes you'll feel cramping down here in your calf muscle, and that's the gastrocnemius. And that's because the gastrocnemius helps with knee flexion. Other two muscles here on the posterior side, back view. First with the plantaris. No origin insertion for this one. The origin is going to be at the lateral supracondylar ridge of your femur, all the way up here. I think it says something differently in the video, so don't trust the video's origin here. Okay. So the lateral supracondylar ridge, so all the way up there. And then it's going to insert at the posterior calcaneus. Again, also inserting at the heel. So the plantaris is also going to help with knee flexion. And again, that should make sense. It crosses that knee joint there, with muscle fibers going straight up and down. Thirdly, we've also got the popliteus muscle. Do not need to know origin insertion, but notice here it's on the back side and it comes down at a diagonal. It does cross that knee joint, so it's going to help with knee flexion. But also, it's going to pull and turn the tibia in. So the popliteus muscle also helps with internal rotation, because it twists the tibia in. Last three that are new to this unit, we got our other three quadriceps muscles. Remember last unit we talked about the rectus femoris. We talked about the rectus femoris in the last unit because that one of the four quadriceps muscles crossed our hip joint. But notice these three muscles here, the vastus muscles, the other three quadriceps muscles do not cross that hip joint. So we got an intermedius, vastus intermedius. We also got vastus lateralis and vastus medialis. The only one I need you to know origin and insertion for is the vastus intermedius. And this one here, you'll notice its origin is the upper 2/3 of the anterior part of your femur. So the front side of your femur, the upper 2/3. And it's going to insert into that tibial tuberosity via the patellar tendon and the patella, just like the rectus femoris. So again, all three of these muscles, if you notice here, they all are going to attach at the patella, and they all go down to that tibial tuberosity. So all of your quadriceps muscles, they help with knee extension, straightening out your knee. So those are all the new muscles, all the unique muscles. Again, origin insertion, we should know the gastrocnemius, the plantaris, and the vastus intermedius. No origin insertion for that. Let's talk about the muscles from the previous unit. Because, for example, here are 3 hamstring muscles. They cross that knee joint. They cross it in the back. So because all 3 cross it in the back here, semimembranosus, semitendinosus, biceps femoris, they're also going to help with the knee flexion. However, notice here they wrap around the sides. Biceps femoris over here, and the semimembranosus and tendinosus over here. So they're also going to help with internal and external rotation of the knee. Specifically, the biceps femoris is going to rotate around the lateral side. So it's going to also help with, I think here, pull, yep. It's going to help with external rotation of the knee. So the biceps femoris helps with external rotation. Versus semimembranosus and tendinosus, they do the opposite. They help with internal rotation of that knee. Going back to the tensor fasciae latae. You got your IT band here. Now this muscle here, notice that it crosses the knee joint in the front. So the tensor fasciae latae also helps with knee extension. Rectus femoris, our 4th quadriceps muscles, including the 3 vastus muscles. Again, it's going to insert on that patella, and by the patellar tendon, go to that tibial tuberosity. So the rectus femoris is also going to help with knee extension, just like the other 3 quadriceps muscles. Sartorius here is also going to help with knee extension, because it comes down in the front. But you'll notice, okay, this is like the inside of your thigh, inner part of your thigh, the anterior medial view. So this is wrapping around the medial portion of your thigh and coming down here. So this tendon is going to pull the tibia this way. And so the sartorius is going to help with knee internal rotation. At the hip, it helps with hip external rotation, but at the knee, it does the opposite. It helps with knee internal rotation along with knee extension. Finally, gracilis here. Gracilis is on that inside there, so it's going to help with knee internal rotation. And again, because it's above, okay, muscle fibers going straight up and down here, it's going to help with knee extension. So knee extension and knee internal rotation. So again, no cadavers next week. If you want to, I'll stick around and I can show you all the other muscles on cadavers, but that will be up to you. That'll be your choice. And again, these are the 3 muscles that I want you to know from this unit for origin and insertion. Questions? All right, anybody need a break here? Need a break. Move right ahead then. At the end, if you want to double check your answers for quiz 10, I'll have the answer key and the questions up there, so feel free to take a look at that. Let's finish it off here. Last one, about to shed a tear. So sad. But muscles that move the ankle. And we're going to have a lot of crossover here with these muscles and the muscles that move the knee. So there's going to be a little bit of crossover, and you'll see that as we get rock and roll. With our ankle, movements of that ankle. Coming up, we got dorsiflexion. Coming down, we got plantar flexion. Easy way to remember it here, dorsiflexion coming up, okay, it looks like a dorsal fin on a shark. Dorsiflexion, foot is up. Versus pointing down, plantar flexion, just like you're pushing into the ground, you're planting, plants come from the ground. So plantar flexion is coming down here. Then we got inversion of the foot, okay, where the sole of the foot is pointing in. Eversion, okay, sole of the foot is pointing out or exiting. Inversion in, eversion exit. Again, you should have this in your notes there. So start off with the soleus. Soleus here. Now this muscle is very similar to the gastrocnemius. You will need to know origin insertion for the soleus. Its origin, okay, it's going to be all the way up top here, okay, is the soleal line. Okay, we didn't talk about this on the bone, okay, because it's hard to see, but basically it's its diagonal part on your tibia, right here. So that's where it's going to originate, okay, as well as the posterior fibula. Okay. So that's going to be its origin. Now, just like the gastrocnemius, it's going to insert, okay, by the Achilles tendon on the posterior calcaneus. So both these muscles, both the gastrocnemius and the soleus, okay, help with plantar flexion. They help with plantar flexion. Now, if you've been involved in athletics, oftentimes coaches will show 2 different stretches for these muscles here. Okay. One is a typical, okay, calf stretch. So your foot is on the ground and you keep your knee straight and you feel stretch in your calf. That is mainly the gastrocnemius that you're stretching, because the gastrocnemius crosses that knee joint. However, if you bend your knee, you'll feel the stretch shifts down more lower here, closer to that Achilles tendon. And what you're stretching there is the soleus. So, let's think about it here. If I wanted a greater stretch on my gastrocnemius, would I have my knee extended or knee flexed? Think about it. You're going to want your knee extended. So if you want a greater stretch on that gastrocnemius, keep your knee straight. If you want to focus more on stretching the soleus, just the soleus, you're going to want to bend that knee. When you bend the knee, you give some slack on that gastrocnemius, so you can just focus on the soleus. But again, quick review here. Both of these help with plantar flexion. Next three. Tibialis anterior, extensor digitorum longus, and extensor hallucis longus. All three of these muscles are on the front side of your shank. Tibialis anterior is the only one I need you to know origin and insertion for. Now, all three of these muscles here on the anterior side, so all three of these are going to help with dorsiflexion. And that should make sense here. Now, if you look specifically at the name, extensor, let's go to the middle here, extensor digitorum longus. We had a similar name for the muscles in the hand. Extensor digitorum, extend your digits. So if I'm taking my hand here and I want to extend my digits, extending my fingers, the natural action for my wrist is to come up. So as I extend my fingers, natural action with the wrist is to come up as well. Same thing with your foot. If I'm going to extend my toes, okay, natural action is for my foot to dorsiflex. So extensor digitorum, you're extending the toes, but at the ankle what's happening is we're dorsiflexion. Similar over here. Remember the pollex, okay, refers to your thumb, so we had extensor pollicis. In the foot here, hallucis refers to the hallux, and the hallux was your big toe. So extensor hallucis means extending your big toe. But the same idea applies here. This is going to help with dorsiflexion. Tibialis anterior. Origin insertion here. Okay. It's going to originate at that lateral condyle of your tibia, and the upper portion there of the tibia. So all the way up there. Now it's going to come down, wrap around, and it's coming all the way across, and it's going to insert at the first metatarsal and the first cuneiform, so all the way down here. So not only is it going to help with dorsiflexion, but it's going to pull your foot in. So the tibialis anterior also helps with foot inversion. Let's look at the backside. Same idea here. Okay. Flexing our big toe, flexing our toes. Natural action is our foot to go down. So all three of these muscles are going to help with foot plantar flexion. Foot plantar flexion there. Flexor digitorum longus, flexor hallucis longus help with plantar flexion. Tibialis posterior, right? It's going to originate at the posterior tibia and fibula. And it's going to come all the way down here, and it's going to insert the navicular bone, the cuboid bone, and your second through fourth metatarsals down here. Now, just like the tibialis anterior, okay, it's going to help with inversion of the foot. So it help with foot inversion, but since it's on the back side, just like your other two flexor muscles, it's going to help with plantar flexion of the foot as well. Peroneus muscles. You got three of these, or you could call fibularis muscles. Okay, these are on the outside, okay, right next to your fibula. So you have your fibula there. These are three fibularis muscles, or you can call them Peroneus muscles. We've got Peroneus longus, which is the longest one. Brevis, meaning brief, so it's a little bit shorter. And tertius, meaning third, okay, so that's even shorter. These two, okay, the tertius and longus, those are the two muscles I want you to know origin and insertion for. Start with that Peroneus longus. Yep, tertius and longus. All right, Peroneus longus, okay, it's going to originate at the upper 2/3 portion of your fibula. Now it's going to wrap around your lateral malleolus, and it's going to go underneath your foot. So it's coming laterally across underneath your foot. It's going to insert at that first metatarsal and first cuneiform. So basically it's coming all the way down and across, and inserting at that first metatarsal and the first cuneiform bone. Similar idea with the fibularis brevis. Okay, coming down and around, but it's going to insert more at the outside. However, since these muscles are on the outside of my shank, they're all going to help with ankle eversion, coming out there to the side. Since the longus and the brevis, so they go around the backside of your lateral malleolus, they're also going to help with plantar flexion of your ankle. So not only eversion, but also plantar flexion. Now, Peroneus tertius down here, it's going to originate at that lower third of your fibula. It's going to insert at the base of your fifth metatarsal. So Peroneus longus, since it's longer, the upper portion of your fibula. Peroneus tertius down, more the distal portion. Now notice this though, instead of going around your lateral malleolus, the Peroneus tertius comes straight down actually in front. So not only does it help with eversion, but it helps with dorsiflexion. So in short, all three Peroneus muscles, they help with eversion of the foot. But whereas the longus and brevis help with plantar flexion, tertius helps with dorsiflexion. Plantaris. So we talked about this muscle at the knee because it crosses that knee joint. Okay. But it also crosses at our ankle joint. Okay. So it's also going to help with plantar flexion. So plantaris also helps with plantar flexion. No cadavers again? Okay. We'll be able to see these on the cadavers. You want to stick around? Okay. Here are origin and insertion.